Hey guys, Dr. Andy here. Today I want to show you shockwave therapy for trigger point therapy, okay? Or trigger points, okay? So we actually kind of discovered this with our first couple of patients, how freaking awesome it works for the trigger point right up here in the shoulder. And the reason why it wasn't kind of immediate obvious to us is that shockwave is typically like really known for tendinopathies. So if you got like plantar fasciitis, Achilles problems, like lateral and medial problems with the elbow, think like tennis elbow or golfer's elbow, that's where shockwave really kind of shines. However, we had a patient that wanted to try it for one of her trigger points in her back, because it's just something that's just been gnawing at her. It's kind of that feeling where you've got that knife right in your back from right, kind of right below the shoulder on the inside. She'd been dealing with that for months. It wasn't quite going away, and she wanted to give shockwave a whirl, okay? And so we had such good, response with it that we wanted to kind of share it with you guys, and then, we've been implementing it with more and more of our patients, all right? So shockwave, if you haven't seen it, is quite simple. What it is it's acoustic wave therapy. So even though it says shockwave, there's no electrical impulses or anything like that. It's not E-stim, all right? What it's doing is it's producing really powerful sound waves. The sound waves go a couple centimeters to an inch or two down into the skin. It starts to break up chronically damaged tissue. Let's say you got like scar tissue. That's why it actually works so incredibly well for trigger points, because that's kind of what's going on. A trigger point is like this big ball of damaged tissue. So the sound waves go down deep, slams into that tissue, literally breaks it apart, the body clears it out, and then mesenchymal stem cells come to the area and then rebuild that muscle tissue from scratch, okay? We typically do it once a week for 4 weeks, maybe 6 weeks, and then you're able to get a huge improvement in that shoulder, okay? So we start with a little bit of ultrasound gel. The ultrasound gel allows the sound waves to penetrate a lot easier and a lot deeper. And then what you're going to hear is a very loud clacking sound. Okay, so what is actually happening is that there's like basically this tube right here in this handheld unit. There's a little bullet inside, and it's flying back and forth, hitting this transmitter head. And each time it hits the transmitter head, you hear that clicking sound. But that click is what's responsible for creating that sound wave, okay? So we put it right on the sore area. And once we find the area that's actually the most sore, when we do this, we communicate with the patient. We ask you how you're feeling. Usually the pain or the discomfort is kind of hanging out like a 2 out of 10 or so. And then once we find that trigger point on you, it jumps up to about a 5 to 6, maybe at worst a 7 out of 10. And then we actually hold it right there for a good 500 pulses or so. And that's how we get the most improvement, okay? Now, I say a 7 out of 10, and you might think to yourself, holy cow, that's really painful. Well, the good news is that no one's quit on us yet. It's one of those good burns, right? It's one of those good pains where when it's going on, you're like, oh my God, that's it. Keep going more, right? So we actually can search around. We're looking for those sore spots, and when we find them, we hold it right there, okay? As I was saying, we probably hit a couple of different trigger points while we're doing it. So treatment time is typically around 10 minutes, okay? And as I said, we do it once a week for 4 weeks, maybe maximum 6 weeks, and it really melts those trigger points. So shockwave therapy is an excellent treatment option for trigger points, especially that annoying sucker right there in the upper back, okay? If you got any questions, send them my way. Always remember to live with passion, not pain.